Hi, my name is Christina Noaks, and I am going to talk about students who have experienced trauma. So some common types of trauma are sexual abuse, physical abuse, emotional abuse, neglect, and witness to domestic violence. According to the DSM, there are some common symptoms of trauma. These include intrusion symptoms like unwanted, upsetting memories, nightmares, flashbacks, avoidance symptoms such as avoiding trauma-related thoughts and feelings, avoiding trauma-related external reminders or triggers, negative alterations in cognitions and mood, that's overly negative thoughts and assumptions about oneself or the world, exaggerated blame of self and others or others for causing the trauma, a decrease in interests and activities, or altercations and arousal and reactivity symptoms such as irritability or aggression, risky behaviors, hypervigilance, difficulty concentrating, and difficulty sleeping. Students experiencing trauma. So according to the American Psychological Association, about 2/3 of children have experienced at least one traumatic event before the age of 16. These traumatic events can affect learning and behavior at school. They are so much more common than what we realize. Race, ethnicity, poverty status, and gender affect the risk of being exposed to a traumatic event. Saunders and Adams collected data on children ages 0 to 17 that reportedly experienced some traumatic events. According to the results of their data, physical abuse and assault, witness to violence, and teasing or emotional bullying are some of the top traumatic events that children experience. Mental health is also affected by trauma. Some of the diagnoses that are affected by trauma are depression, mood disorders, anxiety, PTSD, personality disorder, addictive behavior disorders, eating disorders, memory issues, black and white thinking. Trauma also affects academics and children at school. So children that have experienced trauma have trouble focusing and paying attention in class. They might have trouble communicating or socializing with peers. They may have trouble with their memory, and all of these probably affect IQ scores. Children that have experienced trauma may also have an increase in discipline referrals. So trauma does affect our behavior. Children with trauma may be seen as being absent from school on a frequent basis. They may have suicidal thoughts or gestures, self-harm, risk-taking behaviors, substance abuse, social withdrawal, physical violence, anger, jumpiness, unpredictable and impulsive behaviors. So what can we do? We can create an trauma-informed school. So that just means that we need to constantly keep in mind how traumatic experiences impact the people that you serve. The role of the social worker is a big one in creating a trauma-informed school. First, the social worker can have ongoing staff education and awareness. The social worker should be able to educate teachers, principals, support staff on what trauma is, what it looks like, and how it affects development in children. School social workers should also have ongoing supervision and be assessing for trauma in all psychosocial assessments completed. The school social worker should be trained in TFCBT to be able to implement this type of therapy in individual and group sessions. The school social worker should also create a critical incident debriefing team. So this team would be in charge of coming together whenever there is a physical hold of a student, whenever a student is out of control, or whenever a student feels uncomfortable or unsafe. This team would come together and talk about the triggers of the behavior, the consequences of the behavior, and come up with a plan of what we can do better to help the student be successful next time. The role of the teacher is also very important in creating a trauma-informed school. The teachers are with these students all day, every day, and they need to know what the symptoms look like, how it affects their development, and when it becomes a problem enough for the school social worker to become involved. The school teacher needs to know how to refer students. The school teacher needs to know appropriate interventions with students with trauma. The school teacher needs to know how to create a positive environment to build positive relationships and build on the strengths of the student. The school teachers should also know some appropriate stress reactions when dealing with students. The teacher's job is to keep the student nice and calm and de-escalate if they do become mad. Everybody's goal should be making the school a better place and helping students be academically, socially, and emotionally successful. By doing some of these plans, we will help create a trauma-informed and a trauma-sensitive school. Here are some of the resources.